Ms. Ross from North Carolina for 5 minutes.
Thank you, Mr. Chairman. Right now in America, we're witnessing an unprecedented interference in the ability of physicians to provide the best possible care for their patients. In states across the country, politicians are practicing medicine without a license, getting in the middle of decisions that should be made by a woman and her doctor. We've heard Republicans on this panel say that Americans need to be educated by doctors, not indoctrinated by politicians. I could not agree more. From North Carolina to Arizona, extreme Republican legislatures at the state level have pursued draconian policies to control women's reproductive freedom, in spite of approximately 8 in 10 American adults who believe the decision to have an abortion should be left to a woman and her doctor. And yes, in spite of this, we also have medical consensus from doctors all around the country. They have told us so. The American College of Obstetricians and Gynecologists led 24 medical organizations, including the American Academy of Pediatrics, the American Academy of Family Physicians, the American College of Physicians, the American Medical Women's Association, in filing an amicus brief in Dobbs versus Jackson in opposition to Mississippi's abortion ban after 15 weeks of pregnancy, writing that the ban impermissibly intrudes in the patient-physician relationship by limiting physicians' ability to provide the health care that the patient, in consultation with her physician, decides is best for her health. And that Mississippi's policy places clinicians in the untenable position of choosing between providing care consistent with their best medical judgment, scientific evidence, and the clinician's ethical obligations, or risk losing their medical license. Dr. Shane, as a physician, do you agree that abortion bans intrude on a physician's autonomy to provide the best care for their patients in accordance with their medical judgment?
Thank you for the question. Yes, I do.
Thank you so much. This isn't the only example of physicians speaking out against extreme abortion bans enacted in states across America. In Ohio, the American College of Obstetricians and Gynecologists, the American Medical Association, the Society for Maternal Fetal Medicine filed an amicus brief in opposition to the state's 6-week abortion ban, writing that the law would force clinicians to delay provided needed medical care until a patient is in a critical situation. And by the way, on the opposing side were 18 Republican attorneys general, some might say a group of politicians, who filed a brief in support of the abortion ban. The list goes on and on. Now, let's compare how doctors responded to public health measures implemented during the COVID-19 pandemic. In November 2021, the American Medical Association, led by 60 organizations and more than 30 preeminent doctors, scientists, and public health leaders, had a statement of support for OSHA's vaccine policies. In BST Holdings v. OSHA, the AMA filed an amicus brief in support of the agency's vaccine and testing policies, emphasizing that COVID-19 poses a grave danger to public health and that halting the policies would irreparably harm the public interest. In MB Parent of Minor SB v. Knox County Board of Education, Democracy Forward filed an amicus brief on behalf of the Tennessee chapter of the American Academy of Pediatrics in support of schools making policies, pointing to the significant protection that masking provides to teachers, students, and the community. The list goes on. Dr. Shane, based on everything that I've just shared, do you agree that the vast majority of the physician community supported public health measures implemented to reduce the spread of COVID-19 and overcome the pandemic?
Thank you for the question. Yes, during the time of the COVID pandemic, physicians did overwhelmingly support the mitigation measures that were so life-preserving and enabled people to continue to do some of the essential work like attending schools, going to businesses, and doing all of those other things very, very safely.
Thank you very much. And Mr. Chairman, I yield back.